tiny human enter the world from a fluid-filled room where the body's been curled. A newborn baby with a body that's new. What does that baby have to suddenly do? First breath, lungs expand, oxygen demand, circulation switching up the whole cardiac plan. Inside the placenta, the oxygen ran the show. Now pulmonary blood flow's gotta suddenly grow. Temperature control, glucose regulation, major physiologic transformation. From the womb to the world in a matter of seconds, every single system started new connections. Why the rains get cold? Let me tell you quick. Skin is thin and the fat layer thin as a stick. Brown fat burning, but they can't really shiver. Heat loss happens fast, oxygen they deliver. Cold stress triggers metabolic strain. Glucose dropping low in the neonatal brain. Dry them quick, skin to skin is the move. Wrap them warm so the body can improve. Watch the baby temperature. Watch the baby glucose show. Watch the breathing. Watch the feeds. Give the newborn what it needs. Warm the baby. Feed the baby. Monitor them constantly. First few days are critical. Neonatal physiology. Irish babies, let's run the road. SDA are losing control. Breed of newborns in the NEQ zone. Diabetic mothers add that to the throne. Jittery movement, weak little cry. Feeding poorly, sugar running dry. Seizures late if the glucose falls through. Be fast. IV dextrose coming through. Now fit your lungs with fluid inside. After birth, the clearance didn't coincide. Baby breathing fast like they ran a race. Transient tachypnea, that's the case. C-section, birth increases the rate. Late preterm babies share that fate. But usually within a couple days, you'll see respiration settle naturally. Feed the baby frequently, keep the pattern tight. Respite every 2 to 3 hours, day and night. Formula stretches, maybe 3 or 4. But hydration's what we're looking for. Wet diapers tell the story plain. 6 to 8 means the baby's gain. One more rule every nurse will say: no honey till the first birthday. Look them in the eyes, hold them close. Soft voice speaking while the brain cells grow. Skin to skin contact, you're the star of emotional health and a stronger heart. Bilirubin rising, yellow skin tone. Normal after 24 hours, no. Peak around day 3 to 5. If the baby's feeding well, they'll try. But if they start too early, watch decline. First stage on this is the danger sign. Levels rise and fast in the bloodstream flow. Brain damage risk if the numbers grow. Premature babies high on the list. Who's emerged trauma adds to this. Blood type mismatch can raise the score. For feeding dehydration more. Monitor labs, check the levels right. Phototherapy brings the light. Small baby struggle staying warm. Low blood sugar becomes the norm. Large baby's risk birth injury too. Monitoring what they do. Different sizes, different care. But careful watching everywhere. Preterm baby's born too fast. Organs not ready to last. Equal speed and difficulty. Infection risk and instability. Post-term babies overdue late. Amniotic fluid running low and stay. Dry skin signs of aging girl. Meconium, breathing risk impaired. Listen closely with the chart instead of slow part. Numbing might mean a hole in the heart. PSD between ventricles, you'll see. Love moving where it shouldn't be. Sweating heat and growth delay. Sometimes small holes fade away. Babies born large from insulin flow. After birth, glucose levels go low. Respiratory problems can occur too. Frequent sugar checks are what we do. Premature gut can suddenly fail. Swollen abdomen telling the tale. Bloody stool, heat in decline. Temperature changes the warning sign. Stop the beat, star, IV score. Antibiotics we pour. If the damage gets severe, surgery, the answer here. Drug exposure before the birthday. Withdrawal symptoms on display. High blitzed, crying, tremor, shake. Feeding trouble, belly ache. Swallow tight, lights down low. Calming vitamin, helps them grow. Medication if the symptoms come. Supporting care every time. What's the breathing, what's the feed? Temperature and baby need. Glucose numbers, keep them stable. Strongest start that we're able. From the NIU to the home. Healthy baby, never alone. First to